Institute of Technology, Bombay. Before academia, Priyanka worked with the UN Environment and the World Health Organization. Today's talk is titled Making Air Quality Count. This talk uses a multi-pronged approach to answer the question, how can countries in the global south improve air quality? The talk proposes novel methodologies to combine data from low-cost sensors and satellites to estimate air pollution in locations with limited access to regulatory monitors to fill in the gaps. The talk also describes policy-relevant applications of air quality data, including estimating the health impacts of pollution on vulnerable communities. Finally, the talk ends by describing the barriers to effective policy actions in Nairobi, Kenya, with implications for Indian cities. We welcome you, ma'am, for the talk.
Yeah,
Thank you
welcome,
so much.
Professor Priyanka. So stop sharing.
I'm going to share my window. Awesome. Can you see my the full screen?
Yes.
Amazing. Thank you so much for inviting me to talk as part of this series. It seems amazing. All of the guest speakers who you've had so far are amazing. I know many. I've been looking at the participants list, and I know many. Although I don't know you personally, I know of your work. And so it's really exciting to be here today, and I'm hoping that this can serve as sort of a launch pad for future collaborations. So when I started working on air pollution, I really worked at UN Environment in the science division in Kenya. UN Environment and UN Habitat are the only two UN agencies sort of headquartered in a country in the global south, and they're both headquartered in Nairobi. UN Environment at that point had been given the task of helping countries develop air pollution management plans. And the first thing we did, and the first thing that we did was we looked to see what air pollution data is available. So if you look at the little image on, if you look at the map on the right, where my cursor is, this is a map of regulatory air quality monitoring stations from OpenAQ. Back then, I was based in Nairobi, and you can see that the entire continent of Africa had less than 10 regulatory air quality monitoring stations providing publicly available air pollution data. If you look at India, and I know you know this better than I do, but a lot of the dots on the map of India are gray because they indicate short-term measurements, monitors no longer operational. There's a huge deficit in air pollution data in many countries in the global south. So when I first started thinking about air pollution, I was really taken by this map of satellite-derived PM 2.5 concentrations. This is a map from Randall Martin's group based at Washington University, where they developed techniques to go from the columnar measurements that satellites make of this quantity called aerosol optical depth, and to go from this quantity to surface PM 2.5. And looking at this map, I thought, well, end of story. We have concentrations of air pollution of PM 2.5 in cities around the world. But as this paper on the right shows, because there are few ground-based monitoring stations in countries in Africa, in Indian cities, satellite-derived concentrations of PM 2.5 in these cities can have high amounts of uncertainty. And although they're very, very useful in coming up with regional trends, when used for intra-city or intra-urban analyses, they may not provide robust information. And so this has been, for me, the fundamental context of my work that has sort of set up all of the research that I've done so far. We just don't have robust enough PM 2.5 estimates, for intra-urban analyses in cities around the world. And so one of the first projects that I was involved with was how can we use low-cost sensors to fill in the gaps? And so I had actually deployed 6 low-cost air quality monitors in schools in Nairobi, Kenya, when I worked at the UN Environment. And the goal was, let's see what we can do with these PM 2.5 concentrations. Let's show them to policymakers and see what sort of insights we can get from these monitors despite the uncertainties. We realized several things during the deployment, such as the importance of calibrating these low-cost sensors. We wrote a paper. The paper was fine. It provided these ground-level insights at these different sites, but we wanted to go beyond that. We were interested in, can we use these low-cost sensors to constrain satellite estimates of PM 2.5 concentrations in Nairobi? Can we sort of fuse these two data sources to get better PM 2.5 concentrations from satellite data over the cities and over cities like Nairobi? And when I talk about satellite data, we specifically used this instrument called the multi-angled imaging spectroradiometer, which was on board the Terra satellite. Unfortunately, all of the instruments on board the Terra satellite are being sort of retired, but there are newer satellite instruments proposed, such as Maya, etc., that will provide sort of similar information to MISR in upcoming years. So when we thought about fusing low-cost sensors and satellite data, we figured, in Nairobi, there wasn't a reference monitor at that point. So we said, well, we can't really use the PM 2.5 concentrations because from these low-cost sensors because they have several uncertainties. But let's look at what this low-cost sensor actually does well. And so we were using this AlphaSense low-cost sensor, this low-cost optical particle counter from AlphaSense. What it does is it has a little laser and it counts the number of particles in different size bins. It can't see particles below 0.38 micrometers because it's limited by the wavelength of the laser that it uses. But between 0.38 to 16 micrometers, the OPC was actually pretty good at detecting particles at low relative humidities. So we wondered whether we could use the size distribution within the range that the OPC could see particles and combine that with the size resolved information that the MISR satellite instrument provides. Now, MISR is different from MODIS because it is this multi-angled imaging instrument that can provide size-resolved information of aerosols down to 0.1 micrometers. So there's an overlap between the size ranges that these two instruments can detect, and we wondered whether we could combine the two, the data from the two instruments. So what we did was we got the size distribution from the OPCs, and then MISR actually uses sort of top of atmosphere reflectances to constrain sort of the kinds of particles that the instrument thinks it's seeing. And these retrievals of the type of aerosol from these different aerosol mixtures, this retrieval is consistent over time. So we looked at the successful successful MISR components that were sort of indicated by these successful MISR retrievals. And we said the aerosol optical depth, or the amount of light that is scattered and absorbed by particles as it passes through the atmosphere, is proportional to the number concentration of particles, the optical extinction coefficient, and sort of the length of the atmosphere through which the light passes. And so we said, let's scale this columnar aerosol optical depth to the surface. And then let's try and from this MISR retrieval, get sort of the same thing that we're getting from the low-cost sensor, which is sort of the number concentration of particles in the near surface, in the near surface. And so we scaled the MISR aerosol retrieval using GeoSchem to get this near surface aerosol optical depth. And then this is sort of what the near surface number concentration of particles are from the Miser concentrations. We regressed the size distribution from OPCs against the size distribution from Miser for the range, for the size range over which both instruments could detect particles, which was 0.1 to 3 micrometers. And then from those regressions derived this tau coefficient. And so I know this was a little complicated. So if there's one thing you take away from this, just remember, we used we used the size distribution derived from Miser to constrain the size distribution derived from the OPC to get a better sense of what the size distribution was between 0.1 and 0.38 micrometers. And then from this improved size distribution from the OPC, we were able to estimate an improved PM 2.5 concentration over the city of Nairobi. So how do we test this model? When we tried to see how well the constrained size distribution performed, we actually found that the regressions provided us with a good fit, indicating some confidence in this technique. And we currently have follow-up experiments going to compare the constrained PM 2.5 concentration from the OP derived from this technique with more widely used PM 2.5 concentrations from, Washington University, Sagnigde's estimates, etc. So my first project sort of talked about how I was using remote sensing data and low-cost sensors to fill in gaps. I'm now going to be talking about sort of using low-cost sensors in a mobile setting. So we actually built this platform called the City Scanner, and it comprises of multiple instruments, including an AlphaSense OPC. And a few years ago, we actually deployed these instruments on garbage trucks in Cambridge, in the city of Cambridge, Massachusetts, because garbage trucks travel throughout the city. And so we did this experiment, we collected all of this data, but the city of Cambridge came to us and said, well, you're collecting this low-cost, uncertain, you're collecting PM 2.5 concentration from low-cost, uncertain sensors. What are we going to do with this data? Can it really give us anything robustly? So we asked them, well, what do you want to know? And the most important thing they said was they wanted to identify hotspots. And they wanted to know if we could sort of identify hotspots robustly using these low-cost sensors. So what we did was we took all of the raw PM 2.5 concentrations from the OPC. We said, let's look at PM 2.5 concentrations above 100 micrograms per meter cube. Even if there's error in these low-cost sensors, this threshold is enough to say that even if it's not exactly 100, even if it's 80 or 60 micrograms per meter cube, that's still a high value. So let's look at all of these really high concentrations. Let's cluster concentrations that are within the same 100-meter radius. So in this figure, we actually sized, so the size of each cluster indicates the number of days over which we saw really high PM 2.5 concentrations in the same 100-meter radius. And the color indicates the number of really high measurements we saw in that same radius. So if you look at cluster 3, you're seeing really high measurements over many, many days in the same location. And if you look at what cluster 3 is, I have an image from Google Earth on the right, and it shows this big truck transfer station. So whenever the garbage trucks passed this station, they logged really high concentrations of PM 2.5. And in fact, residents in this neighborhood had been complaining about pollution from this truck transfer station. We did stationary measurements with a higher quality dust track and found that this was indeed an important hotspot. And in this way, we sort of validated the different sort of persistent hotspots that we obtained from this methodology using low-cost sensors. We sort of corrected all of our measurements for being made at different times of day. And after doing this time of day correction, we're able to sort of map out PM 2.5 concentrations over Cambridge. Cambridge, Massachusetts is pretty clean, nothing to see here. And also note that the raw PM 2.5 concentrations from these OPCs have uncertainties. So just take this map with a grain of salt. But what we really did was we said, well, we know that the PM 2.5 concentrations are uncertain, but let's see what this instrument does best. And that is coming up with the number concentration of particles in different size bins within the range that the instrument can actually see particles. So we said, let's plot the number concentrations of large particles having diameters between 1 and 10 micrometers. We know that these large particles tend to deposit out from the atmosphere pretty fast. So we see a high concentration of these large particles. It probably indicates that it's next to an important local source. So if you look at this map, you see these red concentrations over the Malden Bridge. There's actually a casino being constructed right next to the bridge. And so with stationary measurements, we were again able to validate what our low-cost sensors were saying, that there was indeed an important hotspot in this location. Finally, we did things such as we clustered measurements based on their size distribution and plotted the most frequent cluster on each 100-meter road segment. From the properties of each cluster, sort of the average size distribution, we were then able to sort of infer what each cluster represented. So this is a really easy way of doing sort of a source apportionment analysis by clustering measurements belonging to similar size distributions and really seeing what's going on. So you can see that cluster 2 appears to correspond to locations that are impacted by local sources. The yellow measurements belonging to cluster 1 likely correspond to from the properties of each cluster, we found that cluster 1 corresponded to measurements where background aerosol dominated, while cluster 4 belonged to measurements where sort of vehicular emissions were important. So by using the measurements in this way and using what the low-cost sensor actually did well, we were able to make robust sort of we were able to provide the city of Cambridge with robust insights. Specifically, we did all of this analysis because the city of Cambridge wanted to know over which roads should they implement sort of over which routes should they electrify buses in their fleet first. So we use this map to tell them where sort of vehicular pollution dominated and where potentially electrifying their buses would help the most. We have deployed our city scanner in cities across the US, and I don't have a reference here, but we have made all of that data publicly available in a scientific data article. And if any of you are interested in this data, please write to me, and I'm happy to share this database. But we were asked by the city of New York to deploy our city scanner on fleet vehicles, and we did all kinds of simulations to see over how many routine fleet vehicles should we be deploying our monitors to get an X% coverage of the city with at least Y number of runs per road covered. So we did these simulations to sort of inform our other deployments. So key takeaways. Oh, okay. Here is where all of the data from our deployments are, and I'm happy to share them with you. We have deployments in New York, in Canada, in Stockholm, and we also actually then deployed our low-cost sensors on board on board a mobile laboratory operated by Tufts University, where they had higher quality instruments to actually validate the use of low-cost sensors for mobile monitoring. And although I don't have the time to talk about that paper today, I'm happy to share it with you and talk about sort of the research design later. So one of the things that I've been obsessed about with low-cost sensors is their maintenance. I've been obsessed about the fact that these sensors degrade and nobody is really looking into it. So what I did was I actually scraped data for all Purple Air low-cost sensors across the US. If you don't know about Purple Air, there are these $250 low-cost sensors. There are about 16,000 of them, or more than that by now. But when I scraped this data in 2021, there was 16,000 of these low-cost sensors across North America, and compare that with the number of EPA monitors in the US, which number about 6,000. So we have a huge amount of Purple Air data. That data is being used for all kinds of purposes, most importantly, sort of predicting fire and smoke related PM 2.5 across the US. Communities are making decisions based on this data. And I was obsessed with, well, these monitors have been operating since 2016. Some of them have got to be failing. And who's checking? So as I said, I scraped data for about 12,000 monitors in the US. The others that I mentioned were in Canada, but in this study, I just looked at the ones in the US. What's really cool about the Purple Air is that it comprises of two identical plant hour sensors called Channel A and Channel B. So I said, let's assume that a sensor degrades if Channel A and Channel B disagree. But what should that threshold be? What should that disagreement be that we classify the sensor as being, that we classify the measurement as being degraded? So for different degradation thresholds, we identified the Purple Air monitors that were within 100 meters of regulatory EPA monitors. For the different degradation thresholds, we said, let's remove the degraded measurements and see how well the non-degraded measurements agree with the corresponding EPA monitor. We chose a degradation threshold such that the non-degraded measurements agreed best. And so we managed to get a number for this X. After we identified, we came up with a way to identify if a measurement was degraded based on sort of the agreement between these two channels. Across all of these, 12,000 monitors, we plotted the percentage of degraded or the percentage of flagged measurements over operating time. And what's really interesting is that you can see that the number of degraded measurements actually increase over time, almost linearly, and then after 4 years, exponentially. Now, we didn't have a huge number of monitors that had been operated for more than 4 years at the time I scraped this data, and we're in the middle of sort of updating this plot. But it does seem that after 4 years, these sensors can fail dramatically. And so we did things such as we identified sensor IDs of like completely degraded sensors or sensors that were just sort of providing degraded measurements only. And we gave this list to folks at EPA, telling them, when you're using your fire and smoke map, please do not use these sensors. Now, what you might say, well, what if channel A and channel B both degrade in the same way? How do we know that the sensor is we won't know that the sensor is degraded. The sensor will appear to be fine. So another way that we came up with degradation is we identified the 150 Purple Air monitors that were within 50 meters of an EPA site. And we looked to see if after calibrating these sensors, that the error was time dependent. And we were really surprised to see that it was time dependent, and that these sensors were degrading over time. So the error is in per year. So every year, these sensors disagree by 0.12 micrograms per meter cube with the EPA monitors. And every year that difference increases. And what's really interesting is that you can see that climate zone does impact these degradation rates. The degradation rates, for example, are much higher in hot and humid locations. We know that the sensors don't do well with high relative humidity, so that possibly explains why we see this. When we looked at all of the measurements, we found that in hot and dry conditions, we saw a huge number of purple layers that were failing faster than sort of their analogs in other locations. And we think that in hot and dry locations, there's lots of dust, and that is sort of impacting the optics of these low-cost sensors. So all of this to say is that these sensors are degrading. We have to, as a community, think more about degradation. Just this year, we not only looked at the PM sensor, but we looked at the temperature sensors of these purple air and found that those monitors were also degrading over time. Essentially, we joined each purple air monitor with this reanalysis temperature product, and we tried to see whether the difference between the two had a time dimension. And we found that every year, the divergence between the two on average increased by 0.57 degrees Celsius. So over time, that can amount to quite a lot. Okay, so far I've given you a taste of sort of the mobile work that we're doing. I've been giving you a taste of sort of how we can use low-cost sensors reliably to fill in the gaps. But just producing data is not enough. We need policy-relevant applications of these methods in order to make this data relevant to decision makers. And so I'm going to give you examples of how we did that. So during COVID, we'd actually partnered with the University of Nairobi and had deployed these low-cost sensors on the backs of boda bodas or motorbikes. And then COVID hit, and there were lockdowns in the city, and luckily we were able to keep monitoring pollution before and during the COVID-19 curfew. For both time periods, we used this model, this land use model, to sort of predict PM 2.5 concentrations before and after, and then looked at places where there were differences. Now, in general, the blue and the green indicates that pollution levels decreased as we expected because there were less vehicles on the street. But in some areas in Nairobi, we actually found that PM 2.5 concentrations appear to increase. There was a survey done by the University of Birmingham. They did a cook stove study, and they actually found that it was in these neighborhoods, which are some of the poorer in Nairobi, they're informal settlements where, because of the loss of income, many of the residents actually moved back to using, solid fuels for their cooking and energy needs. So we think that it is because of that marked increase in cooking using biomass that we saw an increase in PM 2.5 concentrations. And we were actually able to work with NGOs to sort of help them provide clean cook stoves to those neighborhoods. We did various sensitivity analyses to make sure that we really saw those increases in those neighborhoods, regardless of like the land use regression model or the way that we smoothed and worked with the data. In Denver, I actually have built my own mobile monitoring lab. We have this electric vehicle, and I filled it with equipment. What you can't see is a plenum to control airflows through the different instruments. And the mobile lab that I have measures black carbon, ultrafines, ozone, but it also measures, in addition to these traffic-related pollutants, carbon dioxide and methane. And so I've been sort of mapping, and this is now not low-cost sensors. These are high-quality instruments. I've been mapping the concentrations of these pollutants across Denver. This is an emission factor map. We've been looking at the associations between these pollutants and tree canopy coverage because the city was really interested in do trees actually protect pedestrians from these traffic-related pollutants? And we were shocked, but we actually found, using quite robust statistical models, that trees did seem particles, the ultrafines likely have been depositing on trees, and an increase in tree canopy coverage actually has protected folks from ultrafines. From our campaign, we actually saw really high concentrations of methane in the same 100-meter location, which was actually not detected from an aerial campaign called Methane Air that was also measuring methane from space, and the two campaigns overlapped. And we thought, well, maybe the aircraft didn't see methane because the source was too small. But another thing that we found out recently is that we think the high concentrations we saw is from an old landfill. Now, these landfills only really emit when at low pressures, where you and that when pressures are low, there are more clouds, and the aircrafts are scheduled to fly when there are no clouds, and so aircraft campaigns will keep missing concentrations of methane from these old landfills. And so this is potentially where a mobile lab such as CU Denver's can actually sort of fill in these important gaps and identify the impacts of different sources. I'm going to skip over this. We've done various things, such as we actually have access to sort of home and workplace location of all workers across the US. And using all of these exposure maps, we've been trying to see whether, if you account for home in addition to work, do disparities decrease or increase? And in this study, we actually found really high concentrations, really high disparities at workplaces, higher even than in residential locations, which sort of indicates that if we see disparities in these locations as well, we have to expand sort of our understanding of the forces that are driving these disparities, which for a long time just used to be things such as residential segregation or centered on residential locations, to think about what can be impacting sort of these exposures at workplaces. The study has actually come out, and I think it sort of is expanding how we think about environmental justice. As was said, in the US, the Clean Air Act says that every 5 years, the national ambient air quality standards in the US should be updated based on our latest understanding of air pollution on the health of vulnerable populations. And so I've done a lot of work with Medicaid claims. Medicaid is sort of the government-run health insurance in the US for low-income low-income and or disabled populations. So by definition, the Medicaid population is a vulnerable population. And I've done work sort of looking at associations between exposure to PM 2.5 and cardiovascular hospitalizations, and are the current standards enough? And when I did this paper, we actually found that the short-term standard then was not protective, and a more stringent standard was necessary. I had this paper that was published in the New England Journal of Medicine, sort of looking at associations between PM 2.5 and premature mortality in the Medicare population, or the population in the US greater than 65 years of age, to see if there was a safe limit of PM 2.5 concentrations, and we did not find one. My most recent work has involved looking at menstrual cycle data. There's a lot of toxicological evidence to show that PM 2.5 should impact women's menstrual cycle. Menstrual cycle functioning in women is associated with a whole bunch of health risks, including cardiovascular disease, diabetes, etc. So looking to see whether PM 2.5 concentrations empirically impacted menstrual cycle functioning is important. We actually got data from this app called Clue, which allows women to track their menstrual cycle. And we actually found that long-term exposure to PM 2.5 concentrations was significantly associated with with longer cycle lengths, which is really concerning. And I'm sorry, this paper was published this year in Lancet Planetary Health. And this is actually work that we've done in India. So we actually use the National Family Health Survey or the DHS survey. We did this study looking at associations between PM2.5 concentrations in utero and infant mortality, neonatal mortality, and post-neonatal mortality. And when doing this study, we said, let's look at Randall Martin's or the Washington University PM2.5 concentrations, and let's look at Sagnik Dey's PM2.5 concentrations. Now, the two concentrations actually were not perfect. They disagreed, especially in rural areas where there aren't a huge number of ground-based monitors. This map sort of shows you, the concentration, the time variation of concentrations from Randall Martin's data set versus that of Sagnik Dey's. They're quite different. You can see the correlation of these two data sets by state. And yet, using both these data sets separately, it didn't matter whether we used the Washington University dataset or the IIT Delhi dataset. We actually found that PM2.5 concentration in the last trimester was most strongly associated with infant mortality and neonatal mortality. These results are just from using the Randall Martin's dataset, but we observed very similar results using Sagnik Dey's dataset. We've done similar work in different countries in Africa where we had DHS survey data to sort of look at associations between stunting and in utero PM2.5 exposure and observed concerning results. But I'm going to come back to the work that we've done in India. I think the DHS surveys are an incredible resource. And so what do these surveys do? Basically, from every district in India, a representative number of villages and city and towns are sampled. And the DHS collects all of this information on maternal and child health, as well as socioeconomic status and these other factors. We use this multi-level modeling scheme to go from these individual level responses to come up with district level estimates of all of these socioeconomic variables and health variables for all of India. Here's an example of how we use this data set. And you can, this data set has since been published. But this is an example. So, sorry, this is, we still have our preprint up. It's under review. But this is how we used our data. We said, one of the DHS data, so the first DHS survey was between 2015 and 2016. The last was between 2020 and 2021. Since then, India has has really ramped up electrification, LPG. There have been all of these programs such as PMUY to increase LPG usage and decrease solid fuel usage. So we said, can we actually see if these policy changes have resulted in improvements in health? So for every district, using these multi-level models from the DHS data, we were able to come up with the prevalence of solid fuel use in 2015 and 2020. We came up with the prevalence of hypertension and diabetes in 2015 and 2020, and we said, are the two related? And we found that it did seem that this change in this decrease in solid fuel usage was associated with significant decreases in hypertension. Using this massive data set of the prevalence of SES variables across India, we also did this environmental justice analysis where we looked at associations between these socioeconomic variables and PM2.5 concentrations and found these really, really interesting trends. I'm happy to talk more about it later. I'm just going to race through to the end because I know I don't have that much time left. And so this is perfect. Throughout my career, I've been obsessed with thinking about low-cost sensors and improving all of these techniques, coming up with these data, with these policy relevant applications. But a big concern I had was, well, who actually has these purple air sensors? So I looked at where all of these sensors were located in the US, and we actually found that these sensors, at least in the US, were not being deployed in communities that needed them, but they were being deployed in sort of these more white, more educated communities with lower air pollution levels than sort of the national, with lower air pollution levels than the national average. And so I keep trying to think about, well, I'm developing these techniques, but who is going to benefit from my research? I've done other things. In the US, I've scraped Amazon reviews of low-cost sensors to get a better sense of how people were using them, in order for us to come up with sort of more targeted evaluations of these low-cost sensors to see, well, from these Amazon reviews, people seem to be using these sensors for these topics. We've been doing all of these calibrations. Can these calibrations, are they good enough to answer the questions that people are asking? So this was sort of research that I was very interested in doing, because I wanted to make sure that our techniques sort of matched the use cases of these devices. And finally, I'm going to be talking about work in Nairobi, Kenya. So I started thinking about air pollution when I was based at UN Environment in Nairobi. And if you think back to the first map that I showed from OpenAQ of air quality monitoring stations in Africa, there didn't appear to be a monitor in Kenya. And so much of the work that I'd done was, how do we fill in these gaps? But finally, I actually got down and did a review of air pollution studies done in Kenya, and I found that actually there had been 33 studies done since the early 1980s. And yes, they had all of these limitations, but they all provided consistent insights on sources. And so something that I've been thinking about is, we have enough data to inform policy. How do we create the data infrastructures to make this data actionable? And I think we need to be doing a lot more reviews to sort of consolidate what we know about sources and policy relevant sort of questions. I also started looking at old urban master plans of Nairobi, and I found this really interesting map in the 1920s, in the 1927 plan. And at this time, the British had colonized Nairobi, and they were sort of in power. And in this map, you can see that they say they're going to locate the White Highlands, or the European quarters, far away from the aerial nuisance of industry in the east. And guess who lived in the east? It was Black Africans and Indians who had been brought by the British to build the railways in Nairobi. Now, since Nairobi got independence in the 1960s, much needed land distribution did not happen. What happens is Nairobi is now segregated on the basis of class instead of race. And we still see the impacts of these old urban planning endeavors on air pollution levels in the city. And so my last piece of work is really, we need urban planners, we need public health people, we need scientists all together in the same room to talk about these questions, because ultimately air pollution has been shaped by sort of urban planning decisions that we still see today, and very rarely are urban planners in the room when coming up with air pollution management plans. It tends to be public health folks mainly, but urban planners need to play a role, given that it was urban planning that has actually shaped air pollution patterns in many cities. So with that, I'm going to stop, and I'd happy to answer any questions.
Yeah. Priyanka, thank you very much for wonderful talk on a Friday morning in India. So excellent. So I think I just request participants, if you have any questions, please post your questions in the chat box so that Priyanka will happy to answer them. Yeah, I think we got some questions before that. I just thought it's quite interesting to look at it. LoCa sensors being used, and it is being started, competing with many of the conventional instrumentation. Many measurements are happening across the globe. As you rightly see, one challenge we always see is the LoCa sensors will have some issues with the quality of data they provide. And the second thing is we always look at it, how do we use this data for comparing the air quality? Because we can't, these sensors are not approved by the standard, conventional measurement purpose. So how do you, address this kind of an issue?
I think that the field is still struggling with like how do we use low cost sensors to actually make policy change. In the US, at least, cities across the country are deploying low cost sensors, and they're easy to deploy because, as you said, government doesn't actually have to take action based on the data from these sensors because they don't meet sort of the data quality standards of higher quality instruments. And so the result is cities are just deploying these sensors, but not doing anything with the data. And in fact, I've gotten so frustrated that I've started moving towards using higher quality measurements with our mobile lab because at least, policymakers to take those measurements seriously. That being said, we just did a review this year of looking at all of these low-cost sensor deployments around the world that have been where we found sort of material published. And we said, have we seen these sensors actually drive policy action anywhere? And what were the conditions that led to that? So when in our review, we found that when there were robust sort of partnerships between communities and governments have been forced to take action. But unless you have that back and forth, nothing is going to happen by just putting a low cost sensor there.
Yeah,
So
very.
I don't know. I hope, yeah.
Yeah, that's quite interesting. That's where the I think you have rightly, pointed out. So it's a more like, maybe we can use them kind of an indicator, indicate you in terms of identifying the hotspot. The second aspect, I'm just trying to look at it because we do also working this area for quite long, and one challenge, I don't know how you are able to get so many sensors data. I hope it is available readily in somewhere to access, but in India it is not so. So everybody does the measurements, and there is no common platform except if the government agencies do the measurements, those data will be available. Otherwise, if individual research does the measurements, those informations are not available till they get published. And particularly this low-cost sensors, I think that somewhere that platform need to be shared the way they should understand where they have set up, and it would be easy, useful to the community. Now, considering that aspect, so there are so many vendors are coming up. At least you have indicated purple layer, which is some at least quality. But you have seen that there are so many sensors that are available. And do you also, co-locate these sensors before deploying them to the actual field? So how do we trust this data, and how long this data can be trusted? For example, if you implement this for measurements, can we trust this data for next 3 months or 6 months or any year?
Yeah. No, those are great questions. And like the Purple Air, because their data for a long time was freely available, like that's why we did that big degradation study with Purple Air. I've been trying to get other manufacturers such as AlphaSense to share data from their sensors in order for us to do this degradation analysis, but have not been successful. So I completely take your point about it is frustrating to not have access to data to do all of these important studies, looking at how long these sensors last. And that being said, I think we need to do these studies and we need to keep pushing for people to make their data available, after they publish at least. Organizations such as OpenAQ and the EDF AQ Data Commons are trying to sort of create portals for people to upload data from low-cost sensors. and they make folks provide like metadata so that we know how much to trust these instruments. And that's a key concern. The California Air Resources Board, the European JRC do these short-term checks of these monitors, but lots of people say that, you know, the conditions in these locations are very different from those in an Indian city, and therefore how transferable are these results to Indian cities. And I think at one point when our EPA was still functional, there were all of these talks of setting up sort of a center in a city in the global south. But I think with our current federal administration, EPA has been gutted, and so I don't know the status of that. But hopefully India and Indian researchers will step up because there's so much important work being done on low cost sensors there. I mean, your group, for example.
Yeah, thank you. So now I'll just please look at some of the questions that are there, and we'll come back to you for discussions. So there is a first question. Can you read it or?
Yeah, I can read it. So,
Sure.
Okay, the first question. Most low-cost sensors use light scattering. If we in industry where they use cement and fly ash, can we use these low-cost sensors? Good question. I actually think that cement and fly ash, the particles are, and I may be wrong, but I think the particles may be bigger than you know, than 0.38 micrometers. So maybe using these instruments in such a use case might actually work. The problem with a lot of these instruments, like the plant tower, for example, is that they don't really detect particles greater than 1 micrometer. So I would assume that with cement and fly ash, a lot of your particles would be greater than 1 micrometer. And so you really need a sensor that can detect these larger particles. The AlphaSense OPC is a pretty good sensor for that. So maybe the OPC is your answer. How can we increase the lifetime of low-cost sensors? That's a great question. We actually think that the purple air degrades so fast because like lots of dust gets into these monitors and can clog up the optics of these instruments. Maybe just cleaning the optics by like pumping in compressed air should be enough. John Volkins at CSU actually did some aerosol experiments in chambers where they pumped in a huge amount of aerosol and then pumped in air to clean out the sensors to see if the sensors came back. And I think they got good results. So something as simple as that could potentially extend the lifetime of purple air. Calibration. So we've described this in our papers. And in fact, one of the things that I work on and that I didn't talk about was lots of researchers just sort of put a low-cost sensor next to a reference monitor, develop an algorithm to make the low-cost sensor's data match that of the reference monitor, and then that's it. But that calibration may not actually be transferable to different seasons. It may not be transferable to different locations, especially if you're using, especially if you're sort of, if you have a network of sensors and you're trying to sort of transfer these calibrations. So we've come up with a way to sort of test this transferability, and I'm happy to share that paper with you. No low-cost sensor has been approved for regulatory purposes from US EPA or the European JRC. However, they have been approved as to provide indicative measurements, and which means that local governments can take action based on these sensors. They just can't force sort of saying that the standards have not been met. But there's still a huge amount of ambiguity about what kinds of actions should they take. And finally, on the go versus stop and go. I think like your research design should be completely dependent on what question you're answering, and I'm happy to talk more about that later. And how much does vibration affect the OPC measurements? That's a good question. We actually tried when we deployed these low-cost sensors on vehicles. We actually did a test where we put these low-cost sensors on a vehicle that was being driven around a race course at like really high speeds to see how much vibration there was. And the way we secured the city scanner on vehicles using a really powerful magnet, we found that even when the vehicle was in sort of race mode, the sensor didn't move at all. So we actually think that they do pretty well, although more tests are likely necessary.
Priyanka, thank you so much. I hope there's a lot of things exciting research can come from your group. You are working on an exciting topics. So we're happy to, looking forward to collaborate because our group is also
Absolutely.
works on sensors. So maybe I'll write to you and explore some of the possibilities we can explore in terms of how do we use low-cost sensors. We also set up several sensors now. So probably we are happy to share those data and see that how our collaborations can address and improving the air qualities in urban areas. So with this,
That would be amazing.
thank you very much. And I know it is getting late to you. And thank you very much for your time. So before you leave, can we all start a camera to have one photo for the Air Quality Management Conference and lecture series? Okay, well, so Anupriya, Lakshmi, can you please take the shot? Done? Okay. Yeah, thank you very much, Priyanka. So have a good night. Thank you. Bye-bye. So good day for all rest of you for joining the talk. Thank you. Bye-bye.